Thank you. We move on to the next speaker, Dr. Ashish Ahuja. You ready?
A very good evening to everyone, and I thank AIOS for presenting me with this opportunity. I'll be presenting on the topic of post vitrectomy recovery system. So, vitrectomy surgery requires patients to maintain prone position for a duration of 12 to 14 hours, which varies from 3 to 4 days to about 2 weeks' time. The real world scenario is that it is very difficult for the patients to maintain prone position due to various reasons, could be posture or health related problems. The challenge is to provide early rehabilitation in the post-surgery phase while providing face-down positioning support in the sitting or in the lying down position. PVRS device components includes a tripod-shaped furniture with a horseshoe-shaped cushion, which has a sensor embedded in the headrest. It's a pressure sensor. It's a patent-pending technology. So when the patient places his head on on the horseshoe-shaped cushion, the data gets relayed via the SIM card to our server online. So the doctor and the patient can follow their progress on daily basis. PVRS device is very easy to use, and once the device is connected to the power bank, simply what the patient has to do is place his forehead on the cushion. PVRS system comes along with an angled mirror. When the mirror is placed below the eye level, patients are able to see the objects in front of them. Or if the patients want to use their cell phones or other devices, they may place it over the stand and use it. The rest of the PVRS device can be easily lifted from the stand. The power bank has to be separated, and the device can be used in the sitting or in the lying down position. So we did a pilot study to measure the compliance of patients to maintain face down positioning after vitrectomy surgery. All surgeries were performed by a single surgeon, and patients were asked to maintain prone position for a variable period as long as they were comfortable. 11 patients were included in the study over a period of 6 months, and the prone position duration varied from 4 days to 12 days. So we observed that the adherence was significantly better after macular hole surgery compared to retinal detachment cases. Also because the duration of face down positioning was for a lesser time. Adherence was noted to be higher amongst females compared to male patients. Most cases had a good surgical outcome, and patients were comfortable using the device and felt easier to maintain face down positioning using our device. So to summarize, we observed good acceptance of our device to measure compliance of patients after vitrectomy surgery. The significance of face down positioning to treat retinal detachment and other indications would be assessed in future studies. So PVRS is an innovative device to help patients maintain prone position. It helps to track duration of prone position maintained, and it's a patent pending technology, and this would help patients to improve compliance, to maintain face down positioning, and would help to improve surgical success. Thank you.
Thank you, Ashish. I think that was a very nice presentation, a simple way of putting things, a simple way of doing things. And the best part is that you have also put a stand over there. So in case they want to see their mobiles, they can see their mobiles and can interact on that. Is it, I'm sure, are you doing something to make it, commercially available to everyone? And again, what is the total cost price, per, I mean, how much do you spend in making the whole thing?
Yes, ma'am, we have started working on it commercially in Mumbai, and we'll be rolling it out in other cities. Currently, thing is because there is electronic circuits and sensor, their server has to be maintained. So manufacturing cost just of the device comes to around 9,000 rupees. So we plan to rent it out to patients for about 3,500 rupees for 1 week or 2 weeks as per the physician's advice. So up to 2 weeks, like on a rent. And because this
Yeah,
entire
probably
thing,
because people will not need it for a prolonged period of time and would only need it post-surgery. Dr. Lalit sir, would you want to comment
Yeah,
on
Ashish, a good concept because positioning is a challenge and deters a lot of people from undergoing surgery. Also, fat, obese ladies, they will, just if you counsel them pre-op that position, and a lot of them may not undergo surgery. It's a good device. I'm reminded of my days at RP Center when we used to dig a hole on the head side and put a TV underneath just to keep the patients busy. Something similar modification which you have done and kept a power bank there to keep the patients busy. Good device, as Namrata was saying, because it's a temporary thing and costing may be an issue because patient purchasing that and renting it out may be a better option than patient purchasing because it will cost them. There are special pillows available which we ask my patients to. But day by day, the role of positioning is decreasing because we no longer advocate positioning for more than 1 to 2 days in gas-filled eyes and in silicone-filled eyes. Even a head down position like this may suffice. But nevertheless, a good this thing for people who may not agree for surgery, and then this may work out that their day-to-day work may not get hampered so much. Good.
thank you, sir.
I think we can move on, Namrata.
move on to the next one? I think Dr. Jayaprakash, if you're ready, you can start.
Yes, ma'am. I'm ready, ma'am.
Yes, please.
So Ashish, commercial launch कब हो रहा है?
So we have launched in Mumbai already, and few doctors in Ahmedabad have used it, and in Delhi also.
Send couple of pieces to Delhi.
Yes, sir. I'll send you, sir.
Yeah, sure. Thank you.